That's where the difference comes, like the tribals, they have their own way of living, way of behavior. There are the sophisticated obsessive compulsive, prior when we were studying it was obsessive compulsive state. Now later on that it was state and common disorder, OCD now it's called, obsessive compulsive disorder. This what you call see in movies and all these split personalities and all that, they are all funny stuffs. Like bipolar disorder is the one which is normally found in many people. They want to understand where exactly the learning ability of the man, where exactly is the imagination point, where exactly is the language point, where exactly is the speech center, the visual center, and all these kind of things.
We have spoken about mental illness. How do we categorize mental illness and mental retardation? What is the cause? Come, let's know in this show with the star. Let's join the star, Dr. CKN, a psychologist, molecular scientist, and the innovator of glycemic index diabetic-friendly sugar. Welcome to Dr. C.K.Nandagopalan's YouTube channel. I'm your host, Susan. Hi, Doctor.
Hi.
Doctor, please tell us, how do they categorize mental illness from mental retardation? What is the difference people would like to know?
You want to know mental retardation or mental illness, both?
Both. How do they categorize it?
Okay, in the last maybe around 150 years, you can take it. Psychology has been developed over a span of these 150 years. The one main branch of psychology is abnormal psychology. So this covers the mental illness. Why they call it as abnormal psychology is the expansion for that word abnormal is, the word abnormal means away from normal. So that means you have to understand what is normal. Normal is the Greek word called norma, which means carpenter's square or rule for perfection, whatever you call it. So that's how it starts. So whatever is away from normal in behavioral science.
So what is considered normal, Doctor?
Normal is the one, the word normal is, that is what the word derived from Greek word, which is called carpenter's square or rule for perfection. So in behavioral science, what is away from normal is abnormal. There is no normal behavior, there is an abnormal behavior. That's how you take it.
So in behavioral science, what is considered normal is my question.
That's a relative term, very difficult. So we have a set of pattern, in which we behave. So that varies from continent to continent, that varies from culture to culture, tradition to tradition, all that kind of thing.
Yes, Doctor. So if that is the case, how can they classify it as normal? Because in every different culture, even in the same country, there are so many different cultures and everybody behaves differently.
That's where the difference comes, like the tribals, they have their own way of living, way of behavior. There are the sophisticated, highly civilized urban societies, they have their own. The remote villages, they will have their own behavioral patterns. So all that kind of thing. So here in abnormal psychology, mental illness is defined in a very clear manner. But again, the cause of these problems are unknown. That's another basic problem. So they divide in abnormal psychology into two categories. Minor form of mental illness and major form of mental illness. When it comes to the question of minor form of mental illness, you have hysteria, and you have many number of phobias fear.
Fear. Okay.
Yeah. So if it is hydrophobia, I'm having fear of water.
Yeah.
Claustrophobia, I'm having fear of closed rooms. Like I cannot be comfortable. There is something happening in me when I'm in a closed room, like that. So you have number of phobias are there. Then you have OCD, obsessive compulsive. Prior when we were studying, it was obsessive compulsive state. Now later on that it was state and common disorder. OCD now it's called obsessive compulsive disorder. Then you have depression problems, anxiety and depression, over anxiousness and all that. Then it's called endogenic depression.
What is endogenic depression?
Endogenic depression, manic manifestation. These two things are like for a period of time, this particular individual will be in a depressed manner. Maybe for say, for example, 3-4 months or something. Suddenly he will turn into very active, overactive in his thinking that I'm going to become the CM of the state. I'm going to become the CEO of one of the top multinational company. I'm working towards it. It's more of imaginary. They become very active. So the depressive part and the manic part will keep. They are minor form of manic stages.
Is it like a bipolar, doctor? Bipolar disorder?
Bipolar disorders are next. So when we were studying bipolar disorders were not there. Now after some time bipolar disorders came into picture. So bipolar disorders are again this what you see in movies and all these split personalities and all that. They are all funny stuffs. Like bipolar disorder is the one which is normally found in many people. So their behaviors are ununderstandable sometimes. They hide a lot of things. They don't expose themselves and all that kind of thing. So these are all the minor form of mental illness. So you have to be very clear here. Mental illness is one terminology. Another thing is behavioral disorders. So here emotions play a lot of role. So even though we have localized the brain as thalamus and hypothalamus is playing a lot of role. So we have studied. There is a subject called localization of the brain. That is lesion in the brain. Lesion means damage. The localization in the brain is something they want to understand where exactly the learning ability of the man, where exactly is the imagination point, where exactly is the language point, where exactly is the speech center, the visual center, and all these kind of things.
So they're trying to map the brain.
They will not try to map the brain. The cortex is one portion which is on the surface of the brain on top, what you see visually when you see a brain. It is a part of the cerebrum. So that is the component, the part of the brain which is responsible for all your actions. So it is been divided into 4 different lobes and all that stuff. We will not go into the anatomy part of it. So this guy is the one who controls everything. So they try to make a damage in a particular portion and see which is getting affected a lot. So what is happening here is when you affect a particular portion, they feel that they see that everything is getting affected. So localization of the brain, when it comes to the question of lesion of the brain, they've done a lot of studies. They could manage to arrive at certain things, many things. Rather, this is where the speech center is there, this is where the visual center is there, this is where the hearing center is there, this is where the taste center, all that kind of thing. But this is to study the actions of the brain, what exactly it is doing. But then when it comes to the question of behavioral disorders, it will be very difficult for them to understand what is happening there. So then we come to the major form of mental illness. You have delirium, delusion, and you have paranoid conditions. You have schizophrenia and all that kind of thing. They are all completely minor form of mental disorders are treatable according to the psychiatry by giving you medicines. Again, here it is not a cure. It is some kind of a maintenance. You take some medicines for the rest of your life. But psychotic diseases, or they are called the major form of mental disorders, are called psychotic diseases. The psychotic disorders or diseases, whatever you call it, schizophrenia and all that, where your biochemistry behaves very funny. In a full-blooded schizophrenic patients, you can see a lot of copper content in their blood, which they don't know why it is happening, from where it is happening. The problem in my books is they are unable to study the interrelationship between the brain and the organs. So, in the ancient science, if you see, they would have very clearly given the liver is the major organ which has maximum connection with the brain in terms of exchange of many commands, relationship. Now, recently they have also found the stomach and the brain is having a enormous connection through the vagus nerve, where the gut flora in the stomach is able to communicate with the brain flora and all that. So now they are directly coming into vaguely, but directly, they say that Alzheimer's, dementia, Parkinson's and all that is because of the vagus nerve part. The more of that the lactobacillus in the stomach is getting destroyed, it has its own impact. The communication between the stomach and the brain through the vagus nerve is coming down. They are attributing to that. But however, the major part of what we have to understand here is the microbiome part of the body, what role it plays. We have understood in microbiome that the cell mechanism, the behavior of the cell, the actions of the cell functioning is based on the microbiome part, and the behavioral part of the microbiome is based on the cellular function. So they are interrelated. So what is that we are trying hard to understand here in the modern science is the signaling systems of the human cells, from where they get the signals from to work.
They also say that gut is the second brain. It works as a second.
That is what is the vagus nerve that they have identified now. But basically they could see the basis of it, but what exactly is happening there, which is a puzzle for us till now. So we have not studied much of the microbiome part of the body. So how much of a role it is playing in every function of the body. After all, if you take the human body, the brain is a part of human body. So every part of the body has a single unit. Now here you have to very clearly understand that every cell in your body, say 100 trillion cells, every individual cell in your body has its own, it's an individual by itself. It has emotions, it has everything, like it is like you. It can jump, it can dance, it can laugh, it can speak, it can do everything. But their language is different. So 100 trillion guys are put together as one unit, as an individual. So same wise, if you're going to talk about the consciousness of the human brain, the consciousness is not only available in the human brain. Brain is not the only organ which is responsible for consciousness. It is each and every cell which plays a role. Either it is a heart cell or a liver cell or a adipose tissues in the muscular system or a bones, anything you call it. Bone marrow, everything, the kidney cells, the pancreatic cells, the stomach cells, the intestinal cells. The consciousness is there in every cell. All 100 trillion cells consciousness put together, including the brain, is one wholesome consciousness. That will be very difficult for us to go anywhere near to understand what is these behavioral disorders are. Now, you are asking about mental retardation. Mental retardation is something which is by birth. The retarded children are born. The structural part of the brain is smaller. Like if it's easy, if you take an adult, if you measure the head, the circumference of the head, it should be minimum 21 inches, and it should not be less than 19. So if you see the mentally retarded children, the head will be small. So the brain is not grown enough. And there is a structural problem there in terms of growth. So then the behavioral disorder sets in there as these children are called retarded. Okay. And when it comes to the question of IQ, what they call it is 90 to 110 is normal, 110 to 130 is above normal, 130 and beyond is 50 is something like supernormal, and 150 and beyond is genius. When you come down, 70 to 90 is below normal, 0 to 20 is idiot, 20 to 50 is imbecile, 50 to 70 is moron. So the word idiot comes from there. The word idiot comes from there. Now we scold people, hey idiot, come here, like that. That word idiot comes from there. It's a scientific terminology. The word given, the noun given there. A 0 to 20 guy with poor intelligence, only 0 to 20 IQ is there. He is one guy who will not know if there is a fire burning. If he go and touches it, he will get burned. He will go and touch it. He will go and stand in front of the track. He will not know that if the train is also coming, he will going to die. He will not. He will be smiling and looking at the train. It's something like that. So this is one side. Another side is epilepsy. That's the last. Okay. You know what is epilepsy, right? The fits you get. There are many different types of epilepsy now.
What happens during epilepsy, doctor? Sorry.
There are every organ in the body is working with a rhythmic condition. They work in a rhythm. That is what we go and measure. So here we go and measure it with electroencephalogram. Now MRI is also come. Magnetic resonance imaging for the brain has also come in the last 10-15 years, whatever. Now we have alpha, beta and gamma waves. They have to be in sequence. This is what they go and read through the machine. It makes the graph. So you can see the difference. These waves are disturbed. Like how you go electrocardiogram. Echocardiogram is through the ultrasound. Electrocardiogram is reading the waves, the heart pumping waves. Okay. Here you have this alpha, beta, gamma rays, gamma waves it's called, not rays, waves. Now they have added delta waves also when you're sleeping deep, all that kind of thing. So in a fits there is a enormous disturbance is happening. These waves are completely distorted for a period of time. At that time, you shake yourself and whatever happens, you know what a fits patient can do. So again, we have no cure for this. We don't know why it is happening, what is the cause of the problem. There are many classifications. Those days they used to have this petit mal and grand mal. These are all French words. A petit mal is a minor form of fits. It comes once in a way in a small manner. Grand mal comes very frequently and very severely, where they cut the tongue and they bite the tongue and cut it off. All that kind of severity, then they will have froth from the mouth, all that kind of thing. So these are all the overall behavioral disorders. So the retardation is by birth. The other mental disorders are divided into two, like major form of behavioral disorders, mental illness, and minor form of mental illness. Minor form of mental illness are also called neuroticism. Now neuropsychosis is also, neuropsychology is also being studied in a large manner. You have, they study the chemical part of the brain. For different kind of emotions, there are many chemicals are produced by the brain, or it is coming from elsewhere, we don't know. All this kind of thing. If there is some chemical is lacking, see, dopamine is one of the major stuff. The DHA is another component. That is docosahexaenic acid. That is one of the main component in the brain. These are all been studied. The chemical part of the brain has been studied, but we are not having any kind of cure for most of these problems. We again try to give certain psychiatric medicines to stabilize these people. So it may work, it may not work. Longer duration of these medicines may get saturated and may not work, and you have to increase the dosage, which is not going to be good enough for these people. These are all the overall picture of mental illness and mental disorders. This lowest IQ also comes into play. Yeah, that's it.
Oh, thank you, doctor. That was an eye-opener for us. That was very educative. Thank you very much. We have come to the end of this episode. We will continue more on psychological problems that we face in our day-to-day lives. Till then, it's your host, Susan, signing off. Please like, subscribe, and share to the ones you care. Love you all.